Close to 180,000 confirmed cases, 1,460 people dead. Since the first outbreak in Mexico in March, the flu virus H1N1 has spread to all continents. The pandemic is worrying, and it raises many questions about the scale of the virus in the future and the strategies in place to deal with it.
The first thing we need to keep in mind is that there are a large number of uncertainties concerning this pandemic. The responsibility we have as medical professionals is to avoid any excessive response while remaining vigilant. There are many epidemiologists who agree that the percentage of people contaminated could reach up to 30%, with a case fatality ratio of up to 1 in 1,000 due to this new type of flu.
The virus is new and spreading rapidly. The countries most affected, such as the United States and Great Britain, have abandoned the strategy of isolating patients. It's a race against time to produce a vaccine, but it won't be ready in time for the first wave of the epidemic.
We have spoken a lot about the vaccine, although it isn't available at the moment as it is currently in the clinical development stage. It'll most likely be ready for industrial production in September or October, which means it won't be available for the first wave of this epidemic. So to ensure success, the strategy must be to identify and treat severe cases in particular, to reduce the number of deaths as far as possible.
Another concern is the lack of medical personnel, material and medicine in many of the countries where MSF works. They are in short supply like the vaccine. Rich countries have already bought 90% of the vaccines that will be produced this year, against World Health Organization recommendations.
They'll probably be able to carry out priority vaccinations amongst the most vulnerable populations, including children, young adults, pregnant women, and people suffering from chronic illnesses, whereas poor countries will only have 10%. This is a small percentage of the vaccines produced, and at best these countries will only be able to vaccinate their medical professionals. Therefore, we can clearly see that this strategy, initially decided by rich countries, is based on a country's purchasing power instead of a medical strategy.
MSF is ready to help medical teams in countries with the most fragile healthcare systems. The objective is to deal with an influx of H1N1 patients without neglecting those affected by other pathologies.